Hey, what's up, world? It's Matthew with My Real Life TV 505 back here again. It's good to see y'all. It's been a good day, not too bad. I'm here to talk to you a little bit today about my disease, Gaucher disease. As you guys know, it's something I mentioned in the intro to my channel, and I'm going to go ahead and tell you a little bit more about it. So, while I'm telling you about this condition, I'm going to be smoking and medicating on a pre-roll that I picked up at Everest, and of course I had to go with it because it's Girl Scout cookies. Cookies, love them cookies. How can not go with it? Girl Scout cookies is it's a great smoke. It's really good. It's really good. As far as like for me, I enjoy the taste. I enjoy the flavor. I enjoy the aroma. Um, so good. I really do enjoy the medical effects that I get from it. I get kind of more of a uplifted, happy type feeling. I don't get like a sedative. I don't get real heavy or sleepy or anything like that. I still feel like pretty productive, but more like I just feel like a mood enhance. Like it'd be good for those battling like anxiety, depression, PTSD, uh, things like that. Kind of if you're feeling frustrated, this is definitely the strand to smoke is Girl Scout cookies. It just is a really good uplifting effect. So that's what I recommend. Um, so today I'm just chilling. I'm gonna smoke up this Girl Scout cookies pre-roll that I picked up at Everest down on Central, just west of Atrisco, right next to the Little Caesars. Everybody is pretty familiar with that area. Um, so a little bit more about me, Matthew. I'm from Albuquerque, New Mexico, and I want to tell you a little bit about Gaucher disease and my experience with it. Mm, that's not bad. Pretty good. I enjoy that. Okay, so get this. I was 21 years old, and I was working as a correctional officer, and I was working a lot of hours, man. I was working like 16 hour shifts, 16 hours a day, 5 days a week, and I guess and I was working out a lot because I was trying to stay fit, trying to stay healthy. Because I was a really small guy, and my whole purpose was that I needed to stand up to dudes that were like 10 times, 20 times my size. So I used to work out a lot, and I worked a lot, and never really got too much rest, didn't eat too good. But one day while I was at work, I had a bad abdominal pain. Went into the bathroom and I threw up, and the pain was so bad after throwing up that I collapsed. So of course I got rushed to the hospital. It was really cool because the inmates came, like COs and inmates, everybody came to my aid, and it was pretty cool that everybody was able to come together like that. So a good friend of mine flew me down to the hospital, and I spent about a week in the hospital because they noticed that I had like an enlarged spleen, enlarged liver, like my lymph nodes were swollen, my blood counts were off the charts, just everywhere. They found out I was like, anemic, and all kinds of crazy stuff was happening. So they did PET scans and CT scans and GI scans and X-rays and just MRIs and the whole 9 yards, like everything you could think of. And while spending a week in the hospital, I lost a significant amount of weight. And after getting out, they still couldn't diagnose me, so they had me follow up with the cancer center, New Mexico Cancer Center, and had me see an oncologist. And during that time, my hip had went out on me. So like it went out. I just had so much pain. I couldn't use it. It was locked. When I would walk, it would grind and pop, and I just didn't know why. So when I went into the cancer center, I had an appointment. So they were like, "Okay, let's see what's going on." So they pulled bone marrow. And if anyone's ever had bone marrow pulled, you know it is one of the most painful feelings you can ever experience in your life. Basically, they drill a hole into your back, like in the back of my hip. They basically drilled a hole and pumped out bone marrow from my body. And when they tested it, they found out I was infested with these Gaucher cells. So the doctor called me and goes, "Matthew, you're infested with called Gaucher cells." I'm like, "What the hell is Gaucher?" So is one of Gaucher disease is one of the most common um, lysosomal storage disorders. I'm not too sure how to say those big words, and it's a result of not having enough it's like glucosamine something. I can't say it. And it's an important enzyme. Basically, your body lacks a certain enzyme, and this enzyme helps break down fatty chemicals um, that cannot. Okay, so because the body cannot break down these chemicals, a, a fat-laden Gaucher cell buildup in areas increase in the spleen, like the spleen, the liver, and the bone marrow. Basically, and they kind of just, I guess, like just grow in there. So they basically store it in there. They don't allow things to process through your body the way they're supposed to. And if you know about fatty tissues, certain fatty tissues are bad for your body. It can cause like toxins in your body. So basically, my body lacks a certain enzyme because and in replacement of these enzymes, there's these mutated cells called Gaucher cells, and they accumulate. They don't allow things to filter through your body the way they're supposed to, and they kind of start feeding off of things. So like with me, they accumulated in my spleen, and my spleen was like huge. It was large. They said it was like 10 times its normal size. Now here's the thing about Gaucher disease: you're born with this disease, right? So as I was growing up, I had symptoms that nobody paid any attention to because nobody knew what they were looking for. So growing up, I had the chronic bone pain, which everybody dismissed as growing pains. I had the bloody noses, the nonstop bloody noses that would send you to the ER, and they're just like, he's not drinking enough water, he's in the sun too much, he's picking his nose too much. Just dismissed it. I was getting injured easily playing sports, doing like riding skateboards, riding bicycles, playing football. I couldn't. Like, everybody else was able to take hits or fall down, and for me, I'd fall down and I'd end up in the hospital with a torn ligament or something. And it was always dismissed as I was just a rough kid. He's just a rough kid. He's just a rough kid. And so a lot of my symptoms got dismissed over the years. As I grew older, like I said, I got into where I was working this job, where I was working crazy hours, and it was just busy. And the disease, I guess, caught up to me because I wasn't sleeping right, I wasn't eating right, I wasn't taking care of myself right. So the disease kind of caught up to me. So when they finally diagnosed me, I said, okay, well, what is there a cure for Gaucher's disease? And they diagnosed me Gaucher's type 1, which is the most common. There's 3 types. So they said, no, unfortunately, there's not a cure, but the great news is there is a treatment for it. It's called an enzyme replacement therapy. So basically, enzyme replacement therapy is the enzyme that my body is lacking. They basically feed me through my port at the cancer center my infusion, which is my enzyme replacement, which is what helps process and break down all those fatty buildups. So growing up, nobody paid attention to the swollen spleen. You know, nothing, like I said, nothing really caught up until after I turned 21 and wasn't eating right and stuff. So I've been on treatment now for the last 11 years, doing an infusion at the cancer center once every 2 weeks. So I've experienced everything with this disease, from chronic bone pain to chronic fatigue, the anemia, bleeding and bruising disorders, the whole nine yards. You know, I've even had signs of seizures and tremors, like just all kinds of stuff. So with me now, being that I've been through so much, I had my hip replaced in 2009. Remember, I told you the hip went out, and so basically my hip, your normal hip looks like this. My hip, the disease ate up the cartilage and the bone marrow, everything. So it grinded and grinded. So basically, my hip bone looked like that. So I had to get a left total hip replacement at 21 years old. It went through, replaced it, and it's doing great. I mean, here I am now, 32 years old, and the hip is doing really good. Um, the thing that's been hard for me dealing with Gaucher's disease has been dealing with the chronic pain and chronic fatigue, and trying to keep up and feel like a normal 32-year-old. Um, so I've had several jobs. I didn't lose my job at the jail. I ended up getting transferred to a desk job because they saw me no longer fit for duty, being that I had the hip replacement, I had this disease that I had to get treatments for, and I had this chronic fatigue that I just couldn't seem to get under control, and the chronic pain. So they transferred me to a desk job. I did a desk job for a few years. Um, Still had a really hard time keeping up even with that job, just because sitting, standing, bending, twisting, pulling, it just, the pain began, it was too much. It's too much. It's rough. It's hard to deal with pain. When you have pain, chronic pain, it's hard to focus. It's hard to not make mistakes. it's hard to not feel down on yourself. And it's a lot of people tell you it's all in your head, it's all in your head, it's on your head. You know what? To an extent, it is. But when there is physical pain there that you just can't wrap your head around it, it's there, man, and it has to be put under control. So when I was dealing with all this chronic pain, they had me on all kinds of pills. I had me on morphine pills. They've had me on oxycodones. They've had me on 800 milligram ibuprofens. They've had me on muscle relaxers, and I've even been on anxiety meds to control the anxiety that I was getting because of being on these medications and not feeling normal. And that was early on in the diagnosis of the disease. And so now, I tried working after I left that job. I tried working in mechanics because I loved working on cars, and eventually I had a hard time keeping up with that too. Just couldn't keep the energy. My hands were always messed up. My shoulders were always messed up. I couldn't. I just had a hard time. So I figured what I ended up figuring is if this disease is going to make me miserable and kick my ass, I might as well go do something that I love doing. And so I said, what the hell? I went for it and I went and applied at Harley Davidson, and that was my dream, man. That was a dream job. I got that job, nailed it, and I met so many great people in that job. I made great friendships because of that job. I've made friends that have become family, and I've lost a few close friends that I feel became family, and unfortunately because of motorcycle accidents. While I was working at Harley Davidson, man, I did my best to hide how I was feeling, to hide my disease. I tried so hard to not let anybody see the pain that I was dealing with and the fatigue that was tearing me apart. I mean, I was so tired at the end of the day. I was falling asleep driving home, almost getting in accidents, and it was the fatigue was so hard. Even in the middle of the day, trying not to crash at the desk while working, just it became too much, and I didn't want to take medications at work because the medications made me feel miserable, and the chronic pain was getting so hard to stand, and trying to move the bikes and trying to keep up with customers and have the energy to be in there all the time dealing with people, and it became too much, and I finally had to learn how to accept what is and throw the towel, like not basically throw the towel in, but just accept that life was going to be different for me from now on. It wasn't going to be the same, and I'm not your normal typical 32-year-old, and it's okay. I've learned to accept that, and now I'm living my life a lot better, a lot differently. I've been doing a lot more since then. I've been doing a lot more medical cannabis. Unfortunately, I did have to leave the job at Harley Davidson because of my condition. Was not allowing me to be able to. I just couldn't keep up anymore. And I tried and I tried. And I'm a man of pride. And I did my best to hide it. I did my best to work. And the Gaucher disease just caused so much pain for me. It made me miserable. So I decided to just go ahead and throw in the towel, accept what is, and enjoy my life. Really, just enjoy the time with my kids. Find ways to deal with my pain management. Um, take care of my fatigue a little bit better. Take care of myself better, so that way I can watch my son and my daughter grow up. I can enjoy my relationship with my fiance. And every day is a struggle. Every day I have pain, and every day I have chronic fatigue. And there's places sometimes I can't drive because of the fatigue. The thing about this disease is it's so rare. Nobody knows anything about it. And little does anybody know this is October, and everybody knows it's Breast Cancer Awareness Month. But did you also know that it's Gaucher Awareness Month? So let me teach you a little bit about Gauchers. So signs of Gauchers are swollen belly due to an enlarged spleen and liver, bone pain, and easily fractured bones, which is something I deal with every day. I've been diagnosed with chronic bone crises, anemia, low blood counts, and fatigue. When you have low blood count, it can cause you to crash. You know what I mean? Like low red blood counts, low blood iron, um, bleeding and bruising easily. Now, because of your platelets and anemia, of course, you can bruise easily when you get hit. So there's three types of Gaucher's disease. So scientists divide Gaucher's disease into three different types based on presence or the absence of the early onset brain involvement, including Gaucher's disease type 1. Gaucher's disease type 1 is the most common form of disease in Western countries, making up roughly 95% of patients there. Symptoms include spleen and liver enlargement, bone problems, and fatigue. Brain development is normal. learn more about Gaucher disease. One, you can learn about this stuff at gaucherdisease.org. Gaucher disease type 2. This type of Gaucher disease is rare and involves severe neurologic brainstem abnormalities. It is usually fatal within the first 2 years and is currently untreatable because of the severe irreversible brain damage in Gaucher's type 2. Now, this happens in babies, I mind you, like babies that usually don't live past 2 years old. I had a brother that died at 2.5 years old because of leukemia. And it just wasn't because of leukemia, there was more to it. But a child is an angel at that age. It's just an angel. It doesn't even have a chance at life. But for the little bit of life that they do have, they have to live it in pain. And it's horrible. So I want to make I want to make my friends and family and everybody aware of Gaucher's disease. Gaucher's disease type 3. This type of Gaucher's disease is rare in the United States, Europe. However, it is the most common form of disease worldwide. Gaucher's disease type 3 has a severity between types 1 and 2, causing the same symptoms as type 1, plus some neurologic involvement, while patients typically have shortened lifespans. Some can live into their 50s with treatment. So, that's Gaucher's 1, 2, and 3. Now, I was originally diagnosed with Gaucher's type 1. After the chronic bone crises, the bone replacement, and seizures and tremors and some other stuff that I had going on, I guess, some cognitive stuff, they re-diagnosed me with Gaucher's type 3. Now, there's been a lot of debate with doctors and other people in the Gaucher community whether I'm a type 1 or a type 3. So there's been a lot of debate. That's because this disease is so rare and the genetics of it are so complicated. It's difficult to determine a type 2, type 1 and 3. Not a 2. A 2 is easy, but type 1 and 3. So, I mean, there's been a lot of debate as to whether I'm a 1 or 3. I'm not myself, I'm not too sure. I know I got Gaucher's disease and I know I need to make people aware about it. So Gaucher's disease is treatable with enzyme replacement therapy. You get the infusion through your IV once every couple of weeks, and it's that simple. So that's Gaucher's disease. I've chosen to medicate myself with cannabis, using medical cannabis. Out here in the state of New Mexico, we do have medical cannabis. And I use medical cannabis to treat my Gaucher's disease, to treat my chronic pain, to treat my abdominal issues, to treat some of the tremor issues that I have, the cognitive issues, and I also use it for PTSD. Medical cannabis has helped me get off of so many medications. It's helped me get off pain pills. It's helped me get off of stomach medications. It's helped me get off of anxiety medications. It's helped get me off Seroquels. Like, that's a big thing. Like, it can help me get off Seroquel, and I feel like it speaks a lot on its own for medical cannabis. I choose to use medical cannabis all day. Like, I get up in the morning, I take an edible, I smoke a J, and throughout the day I will dose with edibles and J's throughout the day, and some concentrates as well. So for those of you who are Gaucher patients and you are of age and you are dealing with the chronic pain every day, and it's a hard thing to deal with, I'm going to let you know now, medical cannabis works miracles. It really does, and it's worked miracles in my life. It can work miracles in your life, and it's not a bad thing. It's a good thing. And I hope that with this video that I brought some awareness. I brought awareness to the public about Gaucher's disease. And if you have any questions, please feel free to comment and ask. I would love to answer your questions and educate you more about Gaucher's. Or if you have any questions, you can go on to the National Gaucher Foundation. You could go to gaucherdisease.org, and you could learn a lot more about the Gaucher's in depth, and a little bit more about the genetics of it. So I guess that's it, man. I guess that's it. I hope I educated some Gaucher patients on ways to maybe help medicate yourself. Cannabis is not a bad thing. That's why it is called medical cannabis, because it is a medicine and it can definitely help you feel normal and get you through your day. So thank you guys for taking this time to learn a little bit about Gaucher's disease. I appreciate you. And until the next video, thank you for taking the time ahead of time, and look forward to the future. Thank you guys.